Welcome to Amplifying the Patient Journey, a series in which we speak with both providers and patients about the clinical journey with a neurologic condition and what recent advances mean for patients, their providers, and caregivers. In this episode, Melody Barthelemy, a human resources specialist, details her experiences living with migraine, including strategies for tracking episodes and thriving with a busy career. She is joined by Dawn C. Buse, PhD, clinical professor at Albert Einstein College of Medicine, who discusses recent research in the field that changes our understanding of migraine, as well as best treatment and care options.
Hello, I'm Joe Rusko, Editor-in-Chief of Practical Neurology, and I'm here with Melody, who will tell us about her experience living with migraine. Welcome, Melody. Please introduce yourself and tell us a little bit about your experience.
Hi, Joe. Thank you so much for having me. As you stated, my name is Melody. I live in Providence, Rhode Island, and I've been dealing with migraine headache for close to 2 decades now.
Thank you for sharing that. So when were you first diagnosed with migraine, and what was that experience like? For example, what brought you to a physician to talk about migraine?
So I didn't have a history of having headache, period. So when the migraine started, it came on strong and sudden, and I wasn't quite sure what it was. So I kind of went a while without having an actual diagnosis before I went to my doctor and to explain to her what I had been feeling, because I just was shrugging it off. I thought, I'm finishing school. There's just so much going on in my life. This is probably what's bringing on these headaches. So I was probably diagnosed not too long after I started. I don't know an exact date, but I started with the migraine headache in 2008.
Thank you. Sounds frustrating.
It is very frustrating.
So tell us a little bit about how migraine affects your life, including your job and your family life.
Sure, it varies. Oftentimes, it's a slow progression. I might feel the headache coming on, and then it slowly builds up. So I may be able to function at full capacity in the very beginning, and then it just slowly starts to wipe me out throughout the day. When it started, I was wrapping up my final semester of college. So that was really hard to navigate, only because I didn't have a diagnosis and I didn't know what was going on. But once I got into a routine and I knew more about how to handle my condition, I was able to be a little bit more proactive in how I address things. It was difficult going into the workplace again, because right when I graduated college, I got a job shortly after, and it was kind of navigating those instances where the pain became unbearable. So I just had to figure out different ways to address the problem and making accommodations for myself and requesting help when I needed it.
Thank you. What is your degree in, by the way?
So I have undergraduate degrees in biology and psychology.
Oh, perfect. So tell us a little bit about what strategies you've used to minimize the effects of migraine, particularly on your job. It sounds like you don't know when you can expect symptoms coming on and how to deal with that.
I've learned to advocate for myself and also make accommodations. So if I feel that I am in a situation where the headache is getting worse and I may not be able to, leave my place or wherever I'm at, whether it's work or at an event, I just take a moment to step away. And whether that be getting fresh air, getting a cool drink, just something to kind of ease me and put me in a better place, and that's what I do. I've learned that I can function better if I feel better. Just little things that someone may not think is a big deal, but could be a big deal for me to help me feel better.
Great recommendations. Thank you for sharing that. How about your experiences working with physicians to address migraines?
I have to say I've had a really good experience with my PCP. She was a huge advocate for me as well. She listened, she took into account everything that I told her, and she worked with me to find solutions to better address the condition for me. Every patient is different. So I had a really good rapport with my provider where I could send her a message in the patient portal, reach out to her, schedule an appointment, and just kind of talk things through. So for that, I am grateful because we had a really good relationship, so I was able to talk to her.
Now, how about recommendations for someone else who may be dealing with migraine for the first time? What would you recommend?
This is a great question because now I get to think back to when I was first experiencing migraine headache. I would say keep a journal. Write down what you're feeling, what's going on, the intensity of the pain, and keep track of how long does the pain last? At what time of day is the pain the worst? So when you do seek medical attention, you're providing your specialist, your PCP, whomever is providing your care or you're consulting with, a paper trail of what's been going on, because it could be any number of things, but if it is for sure migraine, you at least have some type of documentation that you can say, it started at this time, it went on for this many hours, I tried different things, nothing worked, and this is where I'm at now, and I'm seeking treatment, I'm seeking a consultation to better address the problem. I would say don't wait. If this is something that's continuing, seek medical attention, again, with whomever that may be, a provider, a specialist, and also advocate for yourself. If you're not getting answers, it's okay to seek the opinion of someone else.
Great recommendations, especially the evidence portion. I think a lot of times people shrug off and say, oh, it's something I'm feeling. But when you categorize and mark it down and quantify it, it becomes something else.
My experience with migraine led me to a post I saw about the AbbVie Migraine Career Catalyst Award. And after looking into it and doing some more research on it, I created a submission based on my experience with migraine. And I thought, let me give it a shot. I don't know what could come of it, but what's the worst that could happen? They don't choose me. I submitted my video or my entry into the Migraine Career Catalyst Award, and I won. And it's led me to so many different opportunities to speak about my experience navigating a migraine headache in my career and just in my life over the past almost 2 decades. And I'm so happy I have the opportunity to talk to people about it because it's not a condition that's visible. So when I say I have a migraine headache, no one can see that. Even if I am in pain, I just kind of go through the day again because I've learned different ways to navigate my condition, but that's not the case for everyone. So I'm really happy that I have the opportunity to speak about migraine. And also I've received this award, which allows me to grow in my career as well.
Excellent. Congratulations, by the way.
Thank you.
So any other thoughts or comments that you'd like to make?
Yes, just seek resources. Talk to your provider, whomever you feel comfortable with, learn, just seek out different ways to become familiar with the condition. So again, at the end of the day, it's about advocacy so that you can advocate for yourself.
Excellent. Well, thank you for your time and your insights today, Melody. We really appreciate it.
Thank you.
We also had the opportunity to speak with Dr. Dawn Buse, professor of neurology, about recent research related to migraine.
Hello to all of our listeners. I'm Dawn Buse. I'm a licensed psychologist, and I'm a clinical professor of neurology at Albert Einstein College of Medicine, which is in New York City. So being both a licensed psychologist and a researcher, I have the wonderful honor of learning from patients one-on-one in my office and on a massive scale with studies like the Overcome study, where we surveyed 60,000 people living with migraine. I've been a co-investigator on several very large studies that are really snapshots of life with migraine, like the American Migraine Prevalence and Prevention Study, the Chronic Migraine Epidemiology and Outcome Study, CAMEO, and most recently, the Migraine Clinical Outcome Assessment System grant.
Excellent. Thank you. Now, I know this may seem a little basic for our audience, but could you just give a brief overview of the difference between headache and migraine?
Absolutely. This is really important. Thank you for asking about this, Joe. So migraine is a disease state. You live with migraine, you have migraine, like someone might have diabetes, or they might have epilepsy is a great example, or they might have asthma. And then they have migraine attacks. Like if they have asthma, they might have an asthma attack. Or if they have diabetes, they might have a spike in their blood sugar. So migraine, we talk about as the disease. The migraine attacks are those that happen, and they have phases. And people living with migraine are going to start to say, oh, yes, this makes sense. So we have a pre-headache phase. We can call that the prodrome. And some people have an aura. And the aura can be all sorts of unusual sensory symptoms, often visual, but can be other symptoms as well. Unusual symptoms like having difficulty speaking or thinking you're smelling things that aren't there, olfactory hallucinations, all sorts of interesting things happen during the aura. Then the headache phase. And we all know the headache phase. That's an easy one to notice because head pain is just a terrible experience. And a lot of times people focus on the headache phase, but we have that pre-headache and we have a post-headache phase, the postdrome. And then for people with migraine, they also have a phase in between attacks. We call that the interictal phase. We borrow that from seizures. Seizures are called the ictus, and the time between them is called interictal. So we kind of borrowed that way of thinking for migraine. So people with migraine have attacks, and then they have time between attacks. Could be long time for some people, months or years. Could be days or hours for some people. And why does this matter? Well, we're going to talk about different symptoms in these phases. And once people become their own detective and they notice their symptoms in these phases, that becomes really important for managing migraine. And so a lot of people may be thinking, oh, when bright lights hurt and I go to a 3D movie, I've triggered my attack. Well, more likely is they were in the prodromal phase. The neurochemistry has started and the attack has started, and they were more sensitive to light, more sensitive to motion, sounds, odors. The other things that happen during a prodromal phase that people might recognize, in addition to that extreme sensitivity to light and sound, some people will notice neck pain. A lot of people will notice difficulty with thinking or concentrating. Sometimes people call that brain fog. Some people may notice dizziness. And those were the most common prodromal symptoms that were identified in a recent study that was led by Dr. Todd Schwett and colleagues, where they asked people living with migraine to keep a diary and notice those prodromal symptoms. Amazingly, over 80% of people, when they noticed those symptoms, had the headache phase happen within 1 to 6 hours.
That's so helpful. I think that patients and healthcare providers will appreciate an overview of what's going on in the field in terms of differentiating between attacks and disease state and some of the research. I know that, just as an aside, brain fog itself is being studied because we all have a slightly different definition of brain fog. So it's very helpful for the field to clarify what we mean when we say that.
I'm so glad you mentioned that, Joe. I imagine that brain fog, its definition may have different meanings for different people, and it may have different meanings at different times. Brain fog is something that people talk about with migraine phases. We hear it during pregnancy, postpartum, menopause. It can come on with certain types of medication. It can come from a flu or a cold or being hungover. There's all sorts of bodily experiences that can create this feeling of brain fog or not feeling like your usual level of kind of sharpness, quickness, clear thinking. So this is a topic that patients have talked about for decades, but us researchers, we're catching up now.
Thank you. So tell us a little bit about how migraine affects us. It's not as obvious to others, perhaps, when someone's going through a migraine. So how can it affect someone at work or in their lives?
Migraine can have impacts across every aspect of life. The smallest aspect of life, like people in our qualitative study said, don't ask me what I want for lunch when I have migraine. I can't make that decision. To the biggest aspect of life, people in the Cameo study said, I chose not to have children at all or had fewer children because I was worried I wouldn't be a good enough parent because of migraine, or I didn't want to pass migraine on. It can affect work, school, relationships, as well as self-perception or self-stigma. And the World Health Organization agrees. And in fact, in their major global study of disability, migraine was the second leading cause of years lived with disability for women aged 15 to 49. So we know that migraine can be terribly disabling, impacting not only life during the attacks, but also between attacks, that interictal time. People may choose not to make plans because they feel like, I don't know if I can keep that commitment if I make it. It can be something like choosing not to take a promotion at work or a job that travels, choosing not to go back to school, or feeling like they're able to continue a college degree or other training program. or choosing not to make commitments that they feel like they may not be able to make, like I can't coach my child's soccer team because I don't know if I'll always be there, or I'm not going to say yes to that holiday party or that wedding because I might not make it, and I feel bad and guilty about that. So people make a lot of big life decisions even when they're not having an attack, because they know those attacks may be coming and they're worried about the impact it'll have on them and often other people, coworkers, family members, children. They have a lot of worry and guilt about how their migraine impacts other people.
That's very helpful. So you mentioned the prodrome and how some of these sensory reactions are experienced by some folks. So what are some of the other signs, and how can individuals capture what those signs are for them? Because it's so personalized and so different person by person.
This is where being your own detective is going to come in. And it's going to go back to keeping a diary or however you like to note your symptoms. A lot of people will find that they have pretty routine symptoms. And your symptom may be different from my warning symptom. So for me, it may be neck pain comes on first most of the time. And someone else, it may be that extreme sensitivity to light. And they find, oh no, I'm reaching for my sunglasses inside. And our new understanding, we used to think, oh, this light is triggering it. But now we realize the attack has started, the neurochemical process in the brain and nervous system has started, and that is the pre-headache phase, the prodrome phase.
So what I'm hearing from you is that when a patient who has migraine, they feel their typical prodromal symptoms starting, then their migraine attack has started and the headache phase is coming soon.
That's right. And this is a little shift in thinking. We had always focused on the headache being so disabling, but we're really seeing that there are clear physiologic patterns. And what's interesting is when we talk to people with migraine, when we listen to the person with migraine, they've been telling us this for decades. People living with migraine know this. They know those symptoms. So not only are we reminding people living with migraine to start thinking about phases and know those first symptoms mean the attack has already started, but we have a lot of education to do for all of our healthcare professionals out there, and we're going to work on that.
So in addition to education, what else can individuals do about this? So you feel the symptoms coming on, what can you do about it?
So knowing your prodromal symptoms is really valuable because it gives someone information that an attack has started. And that can give the person a little bit of control in their life, feeling that they've got a little time to wrap up whatever they're doing at work or school or caring for their family. They can get home safely and kind of get everyone taken care of, get themselves set up before the headache phase starts. And that's a really nice element because often people living with migraine feel that the attacks are very unpredictable. They strike without warning and they really wreak havoc in people's lives. So knowing your prodrome gives you a little cushion time to prepare before the headache starts. It's also a great time to start any of those non-pharmacologic comfort treatments that work for someone. It might be therapeutic glasses that filter out painful blue light, or starting a comfortable therapeutic green light. It might be starting a mindfulness or relaxation session, or just getting cozy in a dark, quiet room.
We had the opportunity to speak earlier with Melody, who is super well educated and whose migraines are under control at work and at home, thanks to her really great partnership with her physician. What about someone who has not visited their migraine specialist for a while? Lots of folks, they live with the pain. They're not familiar with the prodrome state. What would you advise for them to do?
So, Joe, we know about 1 billion people with a B live with migraine globally, about 40 million or more in the United States. And we estimate that only half of them have talked to a healthcare professional about migraine. Now, why does this matter? Well, getting the diagnosis into your healthcare records is really important. for a lot of reasons. Being accurately diagnosed is important. And our migraine-specific medications, both the acute medications and the preventive medications, are all by prescription. So it's very important to talk to a healthcare professional to really create that personalized, optimized treatment plan. You mentioned if they hadn't talked to a healthcare professional for a while, what should they do? That's a great point. A lot has changed in migraine care. In addition to having new therapies available, both medication and non-medication therapies, people change. People age and they go through different stages. And so someone's body in their teen years will be different from the pregnancy years, the post-pregnancy years will be different from the menopause years. And even for men, changes occur, such as cardiovascular issues, which could be a contraindication to some medications. So the medication regimen that someone might have started 10 or 20 or 30 years ago might not be the best for them now. So it's really important to check in with your healthcare professional if you've not done that for some time.
Thank you. So your passion for this topic is infectious, and it comes through in our conversation today. What are you excited about on the horizon?
Well, thank you, Joe. I am passionate about this topic. Things have been really evolving in migraine therapies in both the medication and the non-medication sphere in the past decade, and more is happening. And this is really important because even though our medication and non-medication therapies are very helpful for many people, there are still some people for whom they do not work well enough yet. And so I want to really reassure those folks that we are still looking at more therapeutic targets, and more medication and non-medication treatments are being tested now. So that's exciting. We've been doing a lot of research with the concept of stigma. How does someone view themselves living with migraine, and how do others view people living with migraine? And we found that stigma is really an important marker for someone's quality of life, their well-being, and their treatment outcomes. So we're really working to think about how to reduce the self-stigma that's involved with migraine. And one thing that I always want to remind people is this is not your fault. This is a disease that has a genetic predisposition. We know its pathophysiology, and we know some of the treatments that can work. So I really don't want people to live with the burden of stigma, of guilt, embarrassment, shame. This is not your fault. But I do always want to encourage everyone, please talk to your healthcare professional, get diagnosed, get an accurate diagnosis, get the best treatment plan for you. And then beyond that, there's a short list of healthy habits that really matter in migraine. Really having the good quality sleep, staying hydrated, healthy diet, regular exercise or movement, and managing stress are essential. They really do relate to parts of the brain which are involved in migraine. The migraine brain and nervous system thrives on consistency and balance and healthy habits. So please remember those are an essential part of your migraine management care plan. And also, you're not alone. You are so not alone. You're amongst a billion other people living with migraine. And find your community. Listening to this podcast is terrific. Keep educating yourselves because that keeps you hopeful. It lets you know what's coming. It lets you know that we're constantly learning, evolving, and improving our treatment options. And find those communities, be they virtual support groups, be they social media groups which feel supportive. Find those who really understand and you can connect with so that you don't feel alone in this journey, because you're not alone. But all of those things help you feel more confident, help you feel that you are taking action, and help reduce that stigma and improve your quality of life. So those are as important as your medication treatments is your well-being.
Excellent. Thank you.
Thank you to Melody and Dr. Buse for sharing their knowledge and stories with our listeners in this episode of Amplifying the Patient Journey. And thanks to you, our listeners. Be sure to visit practicalneurology.com for more podcasts in the fields of neurology.